Welcome everyone to Mayo Clinic Q&A. I'm Dr. Sanj Kakar. Today, more than 12,000 people in the US are waiting for a life-saving liver transplant. Due to the shortage of available decreased donor organs, this has resulted with an increase in popularity of the living organ donation program. Mayo Clinic in Rochester recently expanded its liver donation program to include both non-directed and paired donation from living donors. Here to discuss this is Mayo Clinic transplant surgeon, Dr. Tumasin Tanner. Welcome to the program, Dr. Tanner. So just if you can explain for everybody listening, what is traditional organ transplantation and what is new about this program?
The organ transplantation, regardless of the organ we're talking about, is the ultimate solution for end-stage organ damage or failure. It's well known and it's very effective in kidney failure, liver failure, heart failure, and lung failure, as well as some other organs. And Mayo Clinic is a pioneer in this field. Liver transplants have been done at Mayo Clinic since 1985, so we're one of the oldest programs running successfully in the country. And the biggest limitation of any transplantation globally is the shortage of organs. So we don't have enough organs to transplant that could go into people in need. That's when living donor transplantation comes into play. And that's what we're discussing today.
And so can you explain, obviously our organs are vitally important to us. And so how does the living donation program actually affect the donor?
Yeah, so specifically for liver is this amazing organ that can regenerate if a piece of liver is missing. So that's the only organ that does that. Because of that, we can actually cut the liver in half. Liver has a right lobe and a left lobe, and depending on the needs by the recipient, we can transplant one of those lobes, and the remaining liver in the donor regenerates to a full size, and the part of the liver that goes into the recipient also regenerates to a full size. So that's how and why we can do this from live donors.
And have you noticed a difference in terms of outcomes of patients receiving a living donor organ?
I need to give some information before actually tackling that. So most of the liver transplants in this country are done from deceased donors. As you said at the beginning, there are about 12,000 people waiting for a liver transplant at any given time. About 7,000 to 8,000 people every year get transplanted with a deceased donor organ. When we talk about deceased donor organs, most of the time we mean a full liver coming from a deceased donor who had designated themselves as a donor prior to their demise. Of those 12,000 people, 1,200 people every year unfortunately die on the waiting list, so they never get a chance to get a liver transplant. And an additional 1,200 people also are delisted because they are deemed too sick for transplant. About 20% of the people on the waiting list never get a chance to get a liver transplant, never get a chance to get their health back. The system in place for allocating deceased donors is what's called a MELT system. This is a scoring system that was actually developed here at Mayo Clinic. It's a very good system, and it's a very good score that predicts mortality or death ratio associated with the liver disease. However, is that it doesn't actually factor in any of the symptoms. Of those 12,000 people on the waiting list, there are a certain number of people who have bad liver disease, bad symptoms that are affecting their lives, but they don't have a high MELT score to show for it. So because of that, those people never get a chance to get a deceased donor organ. So the living donor liver transplantation comes handy for those kind of people. So these are sick people who need a liver, but they don't have a high score to get a deceased donor. So if you do the living donor transplantation in those people, the results are extremely good. If you factor in the fact that if those people didn't get transplants, they would succumb to the disease, as I said, 20% of the people on the wait list do. So that's why the living donor liver transplantation have good results for those kind of people who otherwise have no access to deceased donors.
So when you look at the transplant program itself, be that living donor or deceased donor programs, how many liver transplants are done every year at Mayo Clinic?
Before We started this in 1985, and our living donor liver transplantation program started in 2000, so long-standing programs. We are close to doing our 3,300th liver transplant at Mayo Clinic, Rochester. This is Rochester. And roughly in the last 10 years, the average number of liver transplants per year are about 120. And of those, typically about 20 of them are from living donors. So those are the roughly average numbers for us at Mayo Rochester.
Wow, that's such great news to hear how many thousands of patients that you've helped with this. How has the coronavirus pandemic affected the transplant program?
Coronavirus pandemic affected the transplants a little differently in different parts of the country, as you may imagine. In parts of the country that got affected initially with fortunately big numbers like New York and Detroit area, those transplant programs unfortunately had to slow down quite a bit because they didn't have any hospital beds, let alone do a transplant. So at Mayo Rochester, our numbers have been pretty steady this year. So we do not have any big decrease in numbers. In fact, we have done a few more transplants on average as of today compared to what we would have done for October in any other year.
And as you know, Dr. Tanner, we're learning more about how the coronavirus is affecting the body and certain organ systems. Are you anticipating an increase in demand in transplantation moving forward because of this?
As you may know, first lung transplant has been done for a patient who lost lung function to COVID-19 very successfully. It's a respiratory virus, so it may not be affecting the liver as much as it does the lungs, but it's hard to say. It's also a very, it's a virus that has various effects on endothelial cells and then the circulation. So it's hard to say, but probably we will be at least doing lung transplants for COVID-19 patients.
So when people are listening to this, and especially donors, and they're thinking about potentially becoming a donor for the living organ program, how do you determine who's eligible? How do they get involved?
First of all, we thank them for anybody who's thinking about this. Typically, what has been done until now, until we started these non-directed donor programs, is if a loved one is in need of a liver, and if the chances of that recipient of getting a deceased organ is low, then we tell the recipient that they will get a timely transplant if they have a living donor. So if that's the case, then the recipients get in touch with the living donors, and then the living donors contact us and we take over. So this is the whole evaluation is designed in a way that the evaluation is done by a completely separate team. So there's no conflict of interest from the recipient to donor perspective. What is done for the donor is overall a questionnaire first, and I can tell you where to go to for that questionnaire. It's an online questionnaire, just to make sure they're in good health. Overall, they don't have a personal history of something that would be a complete rule out for donation of the liver. And then after that, if they're fine, then we do a blood type screening. Because the liver's the most important thing is the blood type compatibility, and if they have a acceptable blood type compatibility, then we invite them here to Mayo Rochester to come and do a 2-day evaluation, and that evaluation involves a thorough physical examination, meeting with a hepatologist, a liver specialist, a surgeon, one of us, so a liver surgeon, and other members of the team, including the social worker, the independent liver donor advocate, a psychiatrist. We determine the anatomic suitability with cross-sectional imaging, such as a CT scan or an MRI. And at the end of those 2 days, we gather all the information and we make a decision whether that donor can donate or not.
And in terms of the recovery for the donor, you mentioned obviously the liver being in different lobes and you can take a certain amount. What's the recovery like for a donor?
The recovery is usually about 4 to 5 days in the hospital. And then afterwards, about typically few weeks of recuperating at home because it's an open operation with laparoscopic assistance. It's a midline incision, which is well tolerated. But despite that, we caution donors that there's a weightlifting restriction for about 6 weeks to allow for their muscle and fascia to heal so they don't come back with a hernia. And most people, most donors go back to work within about 6 weeks to 3 months, somewhere there.
This program being available at Mayo Clinic Rochester. What about the other Mayo Clinic campuses?
Mayo Clinic Arizona is the other program that does living donor liver transplantation. Mayo Clinic Florida does not do living donor liver transplantation. So the program that we are starting, which is a non-directed liver donation, will start in Mayo Rochester and will proceed with Mayo Arizona down the line.
So Dr. Tanner, can you explain to us about the new non-directed living liver donation program?
Up till now, we used to just accept directed living donation, meaning people who would like to donate knew their recipients, so knowing that they would come here to get evaluated to be a living donor. What we're starting is a non-directed liver donation, and this is in response to several inquiries we had over the years from people who wanted to donate a part of their liver, although they did not know a recipient, or they did not have a recipient in mind. So this is similar to, when you and I go and donate blood, we don't donate the blood to somebody in mind. We know that we trust the institution, the blood bank, to use that blood for somebody in need. So this is similar to that. That's what we're starting here. So in people who would like to donate to a person of the transplant center's choosing within a criteria that we have, then we're accepting that right now.
This is such tremendous work, Dr. Tanner, and thank you for sharing that with us today. Our thanks to Mayo transplant surgeon, Dr. Tumasin Tanner, for joining us today to discuss living liver donation. Thank you very much.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu. Thanks for listening, and be well.